Access to reproductive health services has been a major challenge for Africa. The just concluded 10th Africa Conference on Sexual Health and Rights aims to change that. Speakers at the meeting looked at the challenges and proposed solutions to a topic that's still taboo in many parts of the continent. Dr. Fatou Fonasise is the co-founder and co-executive director of the Mama Pikin Foundation, a non-governmental organization that champions issues related to women and children in Sierra Leone. VOA caught up with her after a panel on bodily autonomy, reproductive justice and violence against women and girls.
The panel that we just concluded, we had different sets of people. We had someone from the Ministry of Health in Sierra Leone. We had a deputy regional director from UNFPA. We had youth activists. We had a sex worker. And I think what came out was the importance of work on different levels to ensure sexual and reproductive health and rights for women, whether it's us as citizens, whether it's our communities working to change our culture to make sure there's an enabling environment so women can access these services, whether it's countries and UN organizations supporting changing laws and policies and guidelines, the importance of the youth. So it's all of us working together to make sure that women are safe and protected and have access to sexual reproductive health and rights.
Among those in attendance is a youth activist from the Middle East who identifies herself as Layla for security reasons. She says lack of information has been a major challenge facing women in her region as they face oppression against sex activity and information on contraception and family planning, even though women are involved in such practices.
So I think what we learned from this panel was that there's two aspects to sexual and reproductive health and rights. There's the institutional and structural aspect and the cultural aspect. And when it comes to institutional access, the question is, even if it's available, it doesn't necessarily mean it's accessible. And even if it's accessible, doesn't necessarily mean it's quality. Because when we talk about sexual and reproductive health and rights, it's not simply a checklist of rights, but it's also about the quality of life we end up giving women and non-binary people. And also it's the question of how can we make it in the way that's most accessible also for people with disadvantages, so people from rural areas, people with disabilities, refugees, people in conflict contexts.
In 2017, the United Nations Population Fund reported that in Sierra Leone, 1,120 mothers per 100,000 births in the country died from direct and indirect causes related to pregnancy and childbirth. Fabrizia Falcione is the Deputy Regional Director for West and Central Africa of the United Nations Population Fund, or UNFPA. She says access to sexual reproductive health services is fundamental to the development of any nation.
For UNFPA, sexual and reproductive health and rights are core to the empowerment of women, core to societies and to the achievement of gender equality globally. And obviously it's extremely important that there is access to services, that there is the capacity for women and girls to make their own choices, and that policies are conducive to the accessibility and availability.
In his presentation, Sierra Leone's Vice President Dr. Jules Diallo said a curriculum on comprehensive sexuality in schools will be introduced in 2023, calling on deep commitments in supporting maternal and infant health. Eric Kawa reporting for VOA Africa in Freetown, Sierra Leone.